Hello and a very warm welcome to CPD Pulse, a dedicated and a thoughtfully curated KOL podcast series. The first episode will feature Dr. Farida Modi, MD Director and Consultant, DermaCare Skin Clinic Mumbai, on advancing CPD in India, clinical education gaps and global perspectives. Dr. Farida Modi is a leading dermatologist who is known for her contribution in clinical practice as well as medical training. Dr. Farida Modi is a director at the DermaCare Skin Clinic in Mumbai. She has also been associated with Messina and Saifi Hospital and has more than 25 years of experience in both clinical as well as aesthetic dermatology. She is a pioneer in the field of injectables and thread lifts, and she is a national and an international trainer for the procedures of injectables, thread lifts, and also dermal fillers.
Let's dive in, Doctor. So, to our viewers, basically, we know that the healthcare landscape is evolving in our country. And with this evolving landscape, the physicians are facing increased patient loads, rapidly emerging therapies, and varied levels of access to updated medical knowledge, especially in the Tier 2 and Tier 3 cities. So, in today's discussion, we have three broad themes. Firstly, to understand what are the unmet medical education needs. Second, what are the barriers in the CME framework. And thirdly, how the global academic collaborations can strengthen our CME ecosystem in India. With this objective, Doctor, I have some questions for you. So my first question, Doctor, is you have been a clinician and also an educator. What, according to you, are the major challenges that the HCPs are facing today in India, especially in the dermatology therapy area?
Yeah. So yes, I'm a clinician, and I am again someone who likes to get involved in mentoring our young dermatologists, and I'm very passionate about that. So coming to that question, we have number one, a gap in our theory and the real world clinical practice. So when healthcare professionals, they're very well trained in textbook dermatology, but when it comes to coming to the clinics and actually treating patients, decision making, especially in the field of aesthetic dermatology or trichology, or then somewhere illnesses which are chronic, because whatever experience they get is for a year or two, and most of the dermatological conditions are chronic inflammatory disorders. So long-term management, long-term complication, that is something which I feel is always challenging for the young dermatologist. So that basic training and knowledge, I personally feel, should be started while they are in their residency, which is lacking currently. Number two, the pace at which our dermatology is evolving. So every single day we have a new molecule, a new regenerative medicine thing coming up, a new technology coming. So we have maybe a new biologic coming. So it is very fast paced suddenly. And because of this rapidly evolving therapies, somewhere we feel that even though we have a lot of CMEs, we still are struggling because we don't have too much of evidence-based approaches. Like we are hearing that these are things which are happening across the globe and they're coming to our country, but we as physicians are very unsure about using it because they still lack a lot of scientific evidence. And number three is challenge in adopting the newer therapy in our skin type, our socioeconomic background, because all these studies, research studies which is done, is mainly in the Western setup. So, we all the time hesitate there whether they will fit in our body type, our body profile, and our skin type. So these are the three main challenges I like to stress upon.
Great, Dr. Modi. I think very important points that you touched upon, and how really the Indian scenario is different, to the global frameworks, and how, we need to have something which is very specific to the India needs. Wonderful. So I move on to the next question, and which is in terms of if you have the opportunity to design an ideal HCP education framework for our Indian HCPs, which is more like, anchored to the global standards, but more fine-tuned to the Indian reality. So if you had the opportunity to really design such an education framework, what would that look like, and what's your
But
vision?
first, I would be honored to design something like that. So, number one, I would say that we want modules which are made to address our common dermatological condition which we see in our country. So, more of pigmentary disorder, more of hair disorder, which are extremely common with Indian population. Even all our procedural dermatology which are relevant to our practice. So, we want more of those modules. So, we want to bring together the international faculty and the updated their guidelines and see on how we can incorporate with our practice. So, we are not shying away from their guidelines, but I would want to best integrate their guidelines with our practice. And I feel somewhere we need more case driven, more hands on learning. So, I would love to incorporate maybe live demonstration, algorithm for treatment, because right now we have so much of text knowledge, but nowhere do we have proper algorithm. So I think algorithm learning, I would really love to incorporate that in our system. Complication management, because sometimes we struggle there. Real clinical case discussions. So instead of just talking on what is there in the books, you rather talk about real-time case discussion, workshops, of course. And somewhere what we are actually lacking is a standardized mentorship models. We don't have that in our country. So this is how I would like to change our system.
That's what really great elements, Dr. Modi. One is in terms of really the structured approach, which is really fitting to the India needs and the India cases. For example, fungal infections or leprosy, which is more specific and actually the cases which Indian doctors see. So designing it to that, it's a great vision you have, and we'll see how best we could try and incorporate those. And my last question for today, Doctor, for you is there are a lot of global academic collaborations we have, especially like American Academy of Dermatology, etc. How do you think these global academic collaborations could help strengthen our CME ecosystem here in India?
So actually we've started that in the recent past, and I think it's great. But somewhere I feel maybe we can level it up some more and look at probably some student exchange program or trainee exchange program. Also some short-term clinical observer posts maybe for our young dermatologists. Exposure to more of research methodology, because that is really lacking in our country, We would also like to create a global network of dermatologists who can share their best practices, what works for us and what works for them. All the research which is right now happening only internationally, instead of them doing and then we doing separately here, maybe we can look at some joint research thing, and that is how we can go more global. Right now, the guidelines that we have is American guideline or European guideline and Indian guideline. Why can't we look at a joint guideline? So maybe the world is shrinking, and I think our field dermatology also should shrink and should bring all the dermatologists across the globe together. I think if globally something needs to be incorporated, these are a few thoughts which came to my mind.
Oh, amazing perspectives, Doctor. I like the concept of one global perspective. I think that's great, and how we marry, the Indian as well as the global guidelines and the algorithms, and have one common approach to our patients. And the mentorship, I think that's amazing. We should see how we have more students from India having these mentorship opportunities.
Yeah, and it can be exchange program. I'm sure they'll also want to come here and have a look at multiple patients here, because we get to see patients coming from all across India with different socioeconomic background, different culture, different climate, weather, and I'm sure it'll be a good exposure even for them if there is a student exchange program, right?
Medical tourism, so I'm sure there will be something more for education as well. Yeah.
Yes.
Definitely. I think thanks a lot, Dr. Modi, for your time, for being a part of CPD Pulse.
CPD Pulse. Brought to you by Insignia Learning, a leading CME CPD provider for India, Middle East, and APAC.